Local experts in chiropractic care.
And today, Dr. Skip and Julie from Wyss Family Clinic of Chiropractic talking about the connection between tongue ties and sleep apnea. Good morning, you guys.
Good morning.
Okay, you have to educate me. What is a tongue tie?
Tongue tie is excess tissue underneath the tongue in a little baby and or adult. And we'll actually get them in our lips as well.
Oh.
If we look at the body and how it develops when we're really, really little, when we're first being put together, we turn into this big tube. And when that tissue comes together, it creates our spinal column, and then it creates all of our body. And we basically create this midline formation. And we get excess tissue underneath our tongue or in our lips. There's different research out there trying to pinpoint why this happens, but that's not what this conversation's about.
Okay.
So you mentioned adults and kids. I've heard about it mostly in infants, but sometimes adults, it hasn't been caught?
It's exactly what happens.
Okay.
It hasn't been caught. And a lot of the times the threshold is 6 months or younger to get these things removed, snipped, and then get the body work done to help them heal. Past that, you have to see a special oral surgeon to get them taken care of. And generally, oral surgeon or a dentist that's very apt with laser removal can help that when you're older on in life.
Okay, Dr. Julie, what kind of effect can a tongue tie have on infants?
So that's why we see it with the infants, because if a mom is struggling with breastfeeding, so like the comment question is, my baby won't latch, or when they latch, the milk keeps coming out of the sides, or like you notice like they can't open their mouth wide. And so we have to go in then and start to assess, do they have those lip or tongue ties, and then which attributes to swallowing. So if they can't swallow, right, and if it goes unresolved as a child, then they're going to start to deal with that, which then turns into potential sleep apnea for that child, sleep problems, but then as an adult, the greater incidence to have sleep apnea. Some of the research that we've seen, especially for moms, if a mom has obstructed sleep apnea, there's a greater chance that she's going to develop gestational diabetes or have preeclampsia.
It's like one of the #1 causes, actually, which they see all the time in the dental field and back and forth. So we need to get these things assessed. Chiropractors can do that if they have the specialist training in it, and then we can get them to the right dentists to get these things taken care of.
Okay.
Well, that was my question. How can we help if we're coming to visit you?
We assess nonstop. So when we get in littles, when we get in babies with breastfeeding issues, latch issues, we're always checking the mouth. We're always checking the reflexes. We're seeing if they can pull from side to side, open up, but then can they actually lap? See, the tongue's supposed to work like a U shape, and when it doesn't, so when I have my finger in their mouth and I'm feeling for it to lap back, one side will be flat. That's not good. We can't breastfeed or get on a nipple with that. And the other side of it is that we have to check for that tissue. And then we send them to we have trusted dentists that we work with exclusively that do amazing work, and that's right where we send them.
So, Dr. Julie, if we are a struggling breastfeeding mom attempting to breastfeed, how do we get some help from you?
First, give us a phone call.
Okay.
We'll chat with you on the phone. There's never any charge for that. Just give us a call. Like, that's our biggest thing, is we just want to be able to help and give people those resources. And if it's something that we can take care of, we'll schedule that exam, and then we can do that assessment. We can give you that referral out. But it's the same thing for the parents as well. If you're struggling, that's the importance of this, that now we have additional tools and training that we can start to assess, and we can help those adults that are struggling with sleep apnea as well.
So even if we're not pregnant, if we're not nursing, but we notice our sleep is disrupted,
Yes.
this could all be related.
If you snore, we've got a problem. Period. And I'm serious, men and women alike. And the other side of it is the crazy part of it is that's a $90 billion industry. It's insane for sleep, and we have to understand what all that is. But yes, as parents and adults, if we snore, we got to get it checked out. We have certain things that we can put on the fingers that they can sleep with at night, so we can check that sleep.
So you're not going into the sleep study when it's like the cold room and people are looking at you like, how are you going to sleep?
There anyway,
so this way you can do it in the comfort of your own home, in your regular bed, and then we can get all of those results, and we can get that interpreted and find the right thing.
With a real FDA-approved device.
Yeah.
So we're not strapping tons of stuff to our leads and our heads. It's all on our finger. You sleep with it for 3 to 5 days, and then we get an assessment back, and we can get you to the right specialist as well there.
I know where I'm sending Rookie. We've had an issue this week.
Just tell them it's like a Christmas present. I got you this ring.
There you go.
Put this on.
That would be
Christmas
awesome.
present for me, Dr. Skip and Julie, right? Well, you'll find Wyss Family Clinic of Chiropractic on South Webster Avenue in Green Bay. And as Dr. Julie mentioned, you can give them a call, 920-468-4199.
Online, it's wyssclinic.com, and of course, connect on Facebook. They also have a really helpful app. Thanks for being here.
Thanks,
you
you guys.
ladies.